right, so one of the things we need to look at is how do we integrate all these different things that we know how to do into a structured and complete session. And not only what we've learned in crystal surgery, but all the things that we've learned elsewhere. We don't want to throw those away just because we want to do energy healing or crystal surgery. We want to learn how to integrate everything. So what I thought I'd do is demonstrate how I fit it together for myself between all the different bits and pieces that I know about. And of course, my number one thing is the Alexander technique. So we're going to begin there with the Alexander technique. Okay, and I'm going to explain what it is that I'm doing and what I'm looking for, because I'm not doing this in order to give you an Alexander lesson, which is also a very beneficial thing to do, but I'm using the Alexander technique as a platform for my energy healing and crystal surgery work. And so I'm using it in a very specific way. But while I'm about it, I also do want to give you quality Alexander input, because I may as well, and because Alexander technique is a neuromuscular training, and I may as well do that while I'm about it, except I won't be addressing too much of it in terms of your consciousness. I'll just be using it to open up the alignment and open up the energy in your system so that we can get the healing in as well.
Okay.
All right. So we're going to have neuromuscular training at a subliminal level, and we're going to have crystal healing and crystal surgery as well, and maybe a few other things thrown in as we go along. So we know that you have a sore knee, and we're definitely going to be looking at that. And then we'll also be looking at other things that are going on. Right now, what I'm going to do is just check your alignment, and it's pretty good, except I can tell you've got some neck tension. Oh, that's okay, I'll do it, you see. That's right. And pretty much the Alexander technique can be watching paint dry or watching the grass grow. But we'll see what we get going here. And I'm just feeling to see whether the energy can flow from the top of your head to the soles of your feet, and from the soles of your feet up to the top of your head without too much interference. And the areas of interference that I'm sensing are here in the shoulder area. Don't do anything, nothing to worry about. A little bit of tightening through the middle of you over here, and then your legs. You don't have that much sensation in your legs as I would like you to have. So I'll just be monitoring that. You sit, knees bend, hips bend. That's right. Good. Good. And finding the chair. And then I check what happened on the way, and there's that neck tension. And that's it. Can you see? You can feel that lifting, can't you?
Yeah,
now
being taller.
Yeah, and that's because we're getting the muscles to release their overcontraction and get you a little bit lengthened. But don't do it. Don't be anxious. Let me do it. Nice. That's great. That's right. And what you want to do is trust the seat. Trust the chair to support you. And so I can tell from the way that you're sitting in the chair that you've got something going on where you feel something's a little bit out of control in your life. Is there something like that going on?
Yeah.
Is it stress at home?
It's a lot of stress at home.
Oh, okay. So maybe we should look at that also in the session.
That would be helpful.
Okay. All right. And I'm also sensing, let's check this over here. It's as if you're worried about what's coming up behind you, like what you can't see. There's an out of control feeling. Yeah, yes. Yeah. That I can sense that feeling in your musculature where you're on guard, is how I can put it. I can feel that on guard feeling. And that's why I'm doing my Alexander technique to begin with. So I can get this kind of read. You know, the body doesn't lie. It's as simple as that. So it's more accurate for me to get the read from your body than it is to ask you, which I know is strange. But people don't really know what's going on with them, and they hide stuff, you know, from themselves. There's self-deceit going on, but they also don't want to admit to stuff. So I can get a more accurate reading if I just go ahead and do it for myself like this. So, and also I can sense the priorities, you see. You might report one thing to me, but then I can pick up on something else by doing this. And even us just talking about it, you've released quite a lot already. So that acceptance, that acknowledgement is helping. Now, what I can't feel is your feet. Don't do anything. But know where your feet are. Take a moment and think, where are my feet? That's better. And then trust your feet for standing. Beautiful. So that's a little bit tense in the shoulders again, and your arms kind of flew out a little bit from your sides. So we just let the inside of your arm hang close to the body. That's good. Just soften at the knees ever so slightly. And if you put your feet a touch wider apart, that will help also. It does give it nice to have a slightly wider base to stand on. Yeah, without muscle tension. We don't like over-engagement of the musculature in the Alexander technique. We're trying to go in the other direction. That's nice. Good. Oh, Linda, that's very nice. Now you see that sway?
Yeah.
That's correct. And you see you got the breathing change. You even started blowing the breath. That's you releasing a bucket load of tension. And that's what I want before you go on the table, because the quality, now that you've done that little bit of realignment and releasing, will be hugely improved. So next up is table work, and that's what we're going to do next.
Okay.
Great. Right, so we're going to do some Alexander table work now, and you're familiar with that. You've done it before, but I'm going to explain a little bit about what's going on as I'm setting it up, because I don't usually do that, do I? Today's the day, a special day. Okay, so I'm going to ask you to lie with your head over here, and your feet are going to swing there, and if you just swivel around and place yourself on the table. Good. Fantastic. So most people, when they lie down, they don't lie down straight, and it's quite important to get the alignment improved, and so we will look at that. And we'll do, organize your stones. Lovely chevron amethyst. That's very nice. That goes so well with your top too. I love that harmonious color effect. That's nice, right? So let's put your hands here. Good. All right, and before we get too deep into this, I know about your knee. We've been talking about that for a while, and I'm going to do anti-inflammatory for acute for this. Is there anything else going on physically?
My hands are sore. I've been having muscle spasms.
Really? Like
massage?
like,
yeah.
Oh.
Just cramping up.
Do you think it's the fascia being tight?
Mm-hmm.
Yeah.
I think that's part of it for sure, yes.
Part of it, yeah. Okay, so your hands. And we did pick up a little bit on neck tension. Right. And then there was the stress at home.
Yes.
And would you say that that stress at home tends more towards depression or anxiety?
I don't know if it goes with, but I think it's both.
It feels like both?
Yes. Some
I
moments.
know, it's actually very hard to distinguish between the two. So, I tell you what, is there like an anger component involved? Is
Yes.
there grumpiness? And
Yes, there's
okay, then let's go with the antidepressant procedure.
Okay.
Because the antidepressant procedure has got the built-in dealing with the anger and resolving the anger, because anger is one of the sort of pathways by which we become depressed. Suppressing anger or not being able to express ourselves, feeling frustrated, it kind of bottles up and leads to depression. So let's assume that because there is the angry note. And we can't really go wrong, because the anti-anxiety and antidepressant procedures are fairly overlapping. And one of the differences is the anger note. So definitely we'll go with that. All right, so we'll go through this systematically, but let's begin with the Alexander technique. And I like to get the feet placed like this. And we use this little mat here because otherwise your socks slip on the fabric and then you have to grip up in the muscles. And this particular position is called semi-supine because you're lying down. That's the supine part, and the semi part is that your knees are raised and your feet are flat on the table. And this is helpful for your lower back. If you were to put your legs out straight, your lower back would arch here. And this is someone you can just test out, but don't do it now. And in fact, your back is arched. It's and you're twisted. Like over here, I can get my hand in. I can probably get it in, like right there. I'm touching my hand and I'm just getting it in a little bit. And that's the arch in your back, and that's not how we want to be. And this is the strange thing about us. We're so tense we can't even lie down properly. It's so bizarre. We're so messed up. And we're all like that. Even the people who look good, their posture may look good, but I'm telling you, we're all carrying way too much tension. There we go. That's it. Doesn't that feel fabulous?
That really does.
And as I say, unfortunately, it doesn't look like that much. It's like watching paint dry, but honestly, for me, nothing feels like the Alexander technique. It's so, see there already, I can't get my hand in past your spine. Mm-hmm. But there's more, you see, because we can come this way and just lift up ever so slightly. That's it. Let me do it and lengthen you out and then back down again. Lovely.
Nice.
Yeah, it's a relief, isn't it?
Mm-hmm.
Very good. Excellent. Oh, excellent. Actually, I want to turf you off the table and get on myself. My turn. All right. Okay, right. That's it. And so everything that I'm doing now is technically Alexander technique, but see, I learned about energy, and I learned about energy healing by teaching the Alexander technique to so many people. I was giving 15 appointments per day. These were half-hour appointments. And I really got an immediate training in the human energy field and how energy moves through the human body, because I was just doing this in such sheer quantity, this Alexander technique. And then I became telepathic and all kinds of weird stuff too. It just happened on its own from the sheer amount. So very important in the Alexander technique is the head-neck-back relationship. Let's make sure this is in good order. That's it. You see how nicely the head is reorganizing on the top of the neck, and you see there's the muscles lengthening through your back. I bet that feels good. Wonderful. And again, unfortunately, watching paint dry is the name of the game, but you can see the breathing changes every now and again, and that's in response to the release of tension. There we go. And see, this is very ideal, Linda. Your hands are nicely relaxed. You know, people do very strange things. They interlace their fingers. They press their thumbs together like this, and they do all kinds of, but your hands are beautifully relaxed, and you're letting go here, and that's the best thing you could do. You need to do that because as you said, you're using your hands and your forearms a lot with the massage work, and the fascia is getting a little bit tight. That's right. That's it. Unwinding all the way into your neck. I bet you could feel it all the way here. Very, very good. Okay. So now what I want to do is put my hand under your sacrum. So if you could lift up here, and I put my hand under the sacrum like that, and you will feel, and I'll tell you when I think you can feel it already actually, the pulse of your sacral pulse against my hand. So people think I am doing something. Hand. I know. They think I'm doing something with my hand, but it's your sacral pulse pulsing against my hand. I'm not. My hand is completely quiet. It's just like my top hand that you can see on the top of your body. That's how quiet my hand is underneath at the sacrum, and there's the pulse. That's it. That's it. And I'm getting the breathing release, and I like it. That's it. There you go. And there's a little reorganization of the tissue. That's lovely. That's what we want. Now don't help me when I slide my hand out. It will lengthen your back, and it will feel like there's a hole in the table.
Yes.
Yeah, it's the famous hole in the table that doesn't exist. Lovely. All right. Now we do the legs. So what I'm doing is just getting the tension, the habitual tension in your body to release, so that I can get the energy flow to be as easy and strong as possible. If we have tense muscles and if our joints are compressing, every joint is a chakra. And so if our muscles are tight, they pull on the joints and they compress the joints. And then the flow, the energetic flow through our body cannot possibly be as good as if we release that muscle tension and allow a flow. And it's a psychophysical flow. But if you line up the mental and the physical, then you've got a good chance of lining up the energetic as well. And if the mental and the physical are not that well aligned, you've got an uphill battle to get the energetics aligned. So if someone's in a chaotic state and they're very, very tense, you have to do something to get them to relax first. You can't just run in there and sort of force energy to move around in their system. And that's what we're doing here. We're getting you prepped for an excellent energetic input. Nice. And I do like to check how the knees are. That's it. Lovely. You see how you can feel your brainwaves shifting and getting more and more relaxed.
Mm-hmm.
Good. Side. Good. What's important in the Alexander technique is to work with the bones and to get the tissue to soften and release and stop pulling on the bones. That's right. Isn't that delicious?
It is. It's
You actually feel your leg
so
lengthening.
subtle, but so good.
Yeah, because you want to get those contracted muscles to release and lengthen and not to pull. Your muscles should behave as a perfectly fitting suit that allows you to move. We're always pulling ourselves about with our muscles, but actually, if we can learn to allow movement instead of force movement, we do way better. That's lovely. That's excellent. Oh, good. Nice. Top to toe. Isn't that delish?
Mm-hmm. Yes.
I love it. I just love it. That moment when you just feel the muscles go, whew, and they release and lengthen. It's so delicious. Never gets old. That's it. And then because this checking the bottoms of the feet and the tension in the feet. People carry so much. Have you noticed that in your massage work?
Absolutely.
Wow, it's really something. I used to have some clients back in South Africa. They didn't relax until I touched their feet and got their feet to relax. That's it. Nice. There we go. So that is the first part of the Alexander piece. We always go back up to the head, neck, back relationship. Good. Like your hair was caught on something here. Let's see. There we go. Just check that. And then what we'll do is get you set up on the bolster. Let's go get that. And so now, Linda, if you'll just take your knees towards your chest, and I'll put the bolster here and get you organized on the bolster. I think lift up again. The bolster's a bit low. There we go. One of the things you don't want to do is move the bolster around while the person's resting on it, because then they have to stiffen and tighten their body while you're pushing and pulling the bolster.
Good to know.
Yeah. I'll show you. Just see how this feels. I'll do it gently so it doesn't, disrupt things. See how that it has to register in your body if I tug on the bolster and move it around. And I don't want to undo what I've done. So there we are. You know what? I think your iliopsoas muscles are a little bit tight as well. So I'll pay attention to that in due course. All right?
Okay.
Excellent. I think we can move on to the crystal part of what we're doing. Wonderful. Right, so we've done a little bit of Alexander technique, we've done some chair work, we've done a little bit of table work, we're all set up, we've got our palette, we can proceed, and we know we should start with decoding because you said that stuff is going on at home, and so that's relationship stuff. So let's start with some relationship decoding, and then we'll do the detox, and then we'll do the clearing, okay? Because that's what I do. You know, if you were new, I'd have to begin with basic prep. But we've done so many sessions that I can resequence according to a different logic, and that is what I'm going to do here with you today. Okay. I'm going to start with decoding. So I'm going to do relationship decoding, so I need my hemimorphite and my convoluted sheet quartz, and let's get going with that. Here. Start here. Wow, right into the sore knee. Hey! Who would have thunk? Phew. And then the hemimorphite liquefies the cords, and then you literally just pour it into the transformation bowl. See, and this knee doesn't have as many cords. You see, in a way that's predictable, and in a way, no, you have to wait and see. You mustn't decide in advance. Just read what's in front of you. Don't make decisions and analyses. See, even the soles of your feet have got a little bit of cording going in. To do this before. How do you get cords into the soles of your feet?
I was going to ask you that.
I don't know the answer. I'll have to ask the spirits. All right, then I'll come up and do the next chakra up. So let's come here now. This is fan-shaped decoding. Yep. And then in your hands as well, the cords. Okay. When you're working, are you wearing shoes or are you barefoot?
I wear shoes.
Yeah.
Actually, sometimes when I'm at home, I don't wear shoes. When I'm in the office, I wear them.
You know, you were taking a break from massage for a little bit. Not a full break, but something of a break, right?
Yeah, a few months.
I wonder if that didn't render you vulnerable to the cords, because there's a lot of cords here and in your lower legs, and the feet and the hands will resonate, and the forearms and the lower legs resonate. So a lot of cords got in, and I'm pretty sure it's from the massage work. Not that it's not a bad thing, it's just that you're having it's a contact sport. You know, and you're working on people, and their stuff can render you either vulnerable or get into you with the cords. Right there, look there. That's it. Now we can come up here and decode over here. Much fewer here. So that's good. The cords stayed with the extremities. You know, it's preferable. You don't want cords going into your brain and your eyes and so on. So I think your hands and feet are actually protecting you, if you see what I mean. Mm-hmm. All right. So that is decoding, and I'll just check. I'll ask for that guidance from the spirits. Is that enough? And they said yes. And this material, the convoluted sheet quartz, the magic of it is that it puts the white light in even as it's drawing the cords out. And that's why it's so advantageous to use the convoluted sheet quartz. It's really a good tool because of that. Because then I asked the guides, do I need to put the white light in now or can it wait? And they said, hey, you used the convoluted sheet quartz, you know. So it's good having a team that helps you remember and keep track of things, I'll tell you that much. So what the guide said to me that I mustn't forget to do special effects gridding right now at the beginning. So what is that? It's when we inform the energy system what's coming and what we want it to be ready for. And we do want to reduce the amount of inflammation in your body, because you say you've got general aches and pains, you've got, sort of tissue contraction going on here, and then you've got the actual inflammation here at the knee. And let me also just feel this knee. Wow, it's so much better than it was. That's one thing that I can say. Just do the comparison from side to side. But it's just a bit irritable. It's not nearly like it was.
Right.
I want that to feel better, and then we'll see at the end. I'll check it again. All right, so here we go. We're going to do special effects gridding. I'm going to use my zincite needle wand. That's the zincite. It's bumblebee jasper. This is a hematite included quartz crystal from Africa, actually. And we're going to do special effects gridding. We're going to inform the entire energy system that we are working on anti-inflammatory for acute. There we go. Yeah. This is like an advanced note. It's like the headline, so that we know the content of the session. Lovely. This is a full energy field grid. It goes in both directions, north, south, and east, west. And as I get close to the knee, I can feel the zincite needle getting all excited and quivery. Okay, we know you like to do your work. It's funny. There we go. Lovely. My Alexander teacher used to say, lovely, lovely. This is lovely. There we go. Nice. And what's nice to see, if camera will just focus on Linda's face, is she's fallen into a smile. And there's nothing more ideal in a session, especially when someone's reported feeling a little bit stressed and depressed even. And to see their face starts falling into a smile means you're on the right track. Right there. The body doesn't lie. You're not going to naturally fall into a smile unless you're feeling it. Right, so we do need to detox, and what we're going to do is a little combo platter. We're going to use some common opal under the hands. We'll put this here, soak up all that negative feeling that you've got collecting from the little bit of stress at home. There we go. How's that? Nice? Mm-hmm. Good. All right, and then we can put our cashalong under the heels. Good old cashalong, the favorite stone of everyone in the world now, it seems. Won't get enough of it. Oh, that is, wow. Cashalong, that was tangible, wasn't it? That sort of releasing and dropping into the table. Very good. Nice. Okay, and then I think what we should do is grid the root chakra. Make a little nest for my red Uvite on magnesite tool. And do like to use this at the base of the chakra system, but you can't put stones on people's root chakras because that is a not PC thing to do in this day and age. So I prefer to put this root chakra stone between the root and second chakra. That is a better way to go, just like so. That's it. Nice. Now, we talked about that note of anger, and the spirits did say, start detoxing that first. So to detox the anger, I am going to use my sardonyx palm stones that are like this. I do love these stones. They're like works of art. They're so beautiful. And I'm going to actually place them here under the calves. And so this is the beginning of the anti-depression section. But you see, you combine them. You build the session to combine the different elements in a seamless way. And you can plan it out like this. So then I'm actually going to prep by working with my sardonyx sphere. Look at this beauty. Aren't you jealous? I love it. So look at this. Yeah, wait till you feel it. And this will be very relaxing for Linda. And when she relaxes, then I'm going to go over her with the shungite, and that will get the shungite working even better, because you get the, instead of everything going with tension, it goes, oh, that's better, and then it's open, and then you can do a deeper detox with the shungite. And so let's start here. Oh, the spirit said. So if the spirit said, then that's what we do. Haha. Isn't that? You see, I thought your iliopsoas muscles were tight, but now they've released in response to the sardonyx. Who knew? That's very, very interesting. That's very good, Linda. Wow, doesn't it feel expansive? Yeah. And you know what? Your chevron amethyst here around your neck is participating. I don't always see that. Usually the jewelry that people are wearing goes a little more dormant, but this one livened up to participate. Ah, you see there. Yeah, I think sardonyx has some other properties besides releasing the anger, because this is good for the fascia here, isn't it? Yeah, you can feel it. Yeah,
relaxing.
That's good. It's super relaxing. I'm going to read up on sardonyx again after this. It really has been an eye-opener working with sardonyx. It's fantastic. Yeah, it's nice. Right. Alright. So now I'm going to ask the spirits. I said, okay, start here and then do like a chakra wall. That's it. You always one's bumping into the genes here, and that, don't worry about it, just go to the other side. Look over here. Into this tissue. Oh, this is having a profound effect on you, Linda. Shoo. Nice. And your knee already feels different. See that? And it's important not to run along the shin bone with the stones, because the shin bone is incredibly sensitive. You stay on either side, you see, so you stay on the side of the, here's the shin bone, here's where I work on the soft tissue, and I go to the other side and I work on the soft tissue. And you're not massaging, you're infusing the second layer, the layer of the energy field that's right next to the physical body. It's easier to do it by touching the physical body. But if you want to massage, you need to be a massage therapist. You don't just do it. It's technical like everything else. Ask Linda, she's a massage therapist. Now, even though you're not massaging, don't get against any insights you may have because of massage. That's not what I'm saying. Always apply what you know. Don't ever drop what you know. As long as you know it and it's true, it's factual. We are not dealing with beliefs here. We're dealing with technical work. This is unbelievably effective for you. Wow. See, when you feel a response to a stone like this, it's almost, diagnostic. It's almost telling you what's going on. Well, this knee was an angry knee.
Yes.
It was. You can relate to that.
Mm-hmm.
Well, the way that your whole system is responding to this sardonyx is pretty phenomenal. And, I've got to take a read from that. I've got to stay with it. If it's working, if it's happening, I don't stop. I keep going until I feel the full feeling. Like when you're eating a meal, you stop when you feel full. Now I'm getting the full feeling. I'm going to do one more sweep here. That is done. Go this way, say the spirits. That's right. Check that. Check that. Check the heart. All good. And we're great. Excellent. So now we're going to move on to some other steps. I'm going to put the sujolite here. Isn't that interesting that Linda's choice of clothing, now this happens very frequently, that a choice of clothing exactly matches the stone that one should be choosing to work with. So there we go. I was going to use seraphinite on the third eye, and then something said no, use the sujolite. And there it is, just exact match with Linda's top. Absolutely amazing harmony. That will happen more often than you can imagine. And we'll put the sujolite there on the third eye, and that was very calming straight away. And that is part of the antidepressant network. So we've already got the sardonyx. Now we've got the sujolite. Now we're going to work with the shungite, which is also part of an antidepressant procedure. And you know what? The sardonyx did such a good job that I do not need to spend a huge amount of time with the shungites. But let me check this. It's transformed. The sardonyx transformed your arms. That's fabulous. Who knew? Right, so now here. And here. Actually, your energy system saying, hey, don't forget you did use the zincite wand, and that did have a profound effect as well. So let's not forget that part. And we decoded. All right, and now we're detoxing. And that's working so well. And this is more needy than your knee. How did that, that's like a pun. This is more needy than your knee. That's so interesting. So it's as if the energy keeps getting bottled up here, and that's what's causing the stress instead of being able to flow through. And when I think about it, when we're in the Alexander part, I said to you, I can't feel your feet correctly.
Oh, yeah.
Yeah, we need to get that flow through to your feet. So those pieces are aligning with each other, and that's what we want. We want to see an internal consistency and logic coming through as we're working. This is fabulous, just fabulous. Nice. Very good. Wonderful. Beautiful. Don't want to skimp, because this was very meaningful to you the other time we did it. Right, so now I do like to use my hands as well, not only as an Alexander teacher, but there's other stuff that comes through my hands, there's healing that comes through my hands, and my fingertips, and also just my hands just know stuff that the rest of me doesn't. I kind of get out of the way and just let my hands do their thing, and that seems to be beneficial. And what I want to do is actually reorganize this joint via laying on of hands, essentially. So there we go. So I use everything I know in this moment. I'm thinking about my spirit guides, I'm thinking about my Alexander technique, I'm thinking about laying on of hands, I'm thinking about energy healing, and we're getting a very big response. You can see her leg literally rolling out. So it's not me pushing it. Her leg is reorganizing in the hip joint, and that's happening. And then, so that's the relationship of the leg into the trunk, into the torso. But then I also want the upper leg and the lower leg to reorganize their relationship. I'm just going to go and ask the spirits for help, and I keep my hands on the bones, and there we go. Oh my, wow, what do you think?
It felt good, really good.
Yeah, see, now that feels correct. You know, it was just puffed up off the patella was puffed up off the joint, and now it's back seated correctly. Good. So I was not doing an adjustment. I don't know how to do that kind of adjustment. I stay away from what I don't know how to do, what I'm not qualified to do. I just put my hands on the bones and allowed whatever wanted to happen to be invited to happen via that energy input. That's it, to be clear. And it worked nicely. Very good. Thank you. Okay, so Linda, I think before we go any further, let's put a blanket on you. I don't want you to get cold. And we are going to be doing anti-inflammatory for acute, which does make people cold, because that green fluoride is the ice of the mineral kingdom. So we mustn't forget. And of course, this is the magic blanket that everybody loves.
Yes.
Have you ever felt anything this soft? Mm-hmm. I know Belinda in Cape Town has an even fancier one. It's got like sheepskin or something on the one side, and this soft here on the other. But this is what we get in the US, this blanket. All right. And we're not complaining. Good. Feel good?
Yes, thank you.
All right. So now what we'll do, we've done that shungite detox, and we've got the cashelang and the common opal working away, absorbing the toxins and acting like sponges and doing all their good stuff. And what we're going to do now is actually basic prep and just sweep away some of the toxic matter that we have moved into the energy field. So we'll just do our fanning. Side. And of course, we won't forget the soles of the feet, because we even found cording there. That's it. You just check. No, there's nothing over your knee. So that part's good. Alright. Then I can choose which of my sweeping instruments I'm going to sweep with. So this is my quartz with fuchsite or fuchsite in it. That's what that green material is, which is a mica. Fuchsite is a mica. And it moves stagnant energy. So that's pretty good clearing tool. But because Linda's feeling a bit stressed and her system needs calming, I'm going to rather use this one. And this one is amethyst. I'll turn it over there. You can see the amethyst. And then this is calcite, and it's the calcite structure. These are very flattened tops, and it is very soothing material when I sweep with this. It's very settling and reassuring and calming. It's just a lovely soft feeling, and because Linda was feeling a little stressed and uncomfortable, I want to use this one rather. But I do need to clear it in the bowl. Let's get that. Feel it getting heavier. When I feel the stone getting heavier, then I know that it's collecting debris. That's it. It's soothing, isn't it?
Mm-hmm.
Yeah.
You might fall asleep.
Exactly. I felt you zoning out on us there. Don't be fooled. You're not relaxing. You're working. You're being a model. And there's the smile again, you see. So that's always nice to see. Let me go down the midline. Nice. One more time. Right. So then, next step, let's open the chakras. And actually, I think what I want to do is I want to use this end. So this is a chevron amethyst. Here, that's the handle of my wand. And I want to actually use this for adjusting the chakras. Strong, huh?
Mm-hmm.
I've got an experience feeling how the wing and the feathers draw the energy up and out like a fountain. It's actually pretty cool. Pretty cool experience that. Wow. All right. So let's move on to hydrating with moonstone, because there was lots of aches and pains and stuff to do with the fascia being a little bit over-contracted, and in order to work with that, we must hydrate. Hydration is the key for fascia, for muscle tissue, for metabolic health. We must hydrate. And our magic ingredient for hydration is moonstone.
So soothing.
Nothing like it. And moonstone, do you know what it actually is?
Mm-mm.
Because obviously moonstone's not its real name. It's adularia. Adularia.
Oh.
And it has that blue shine. That blue shine that moonstone has, that's adularescence. There's only adularia has it, so they call it adularescence. Tongue twister. I think your knee's better already.
It is.
I can't feel anything there, any stress there anymore. That's all right. We're still going to go forward.
A little bit left in my calves.
Yeah, it's not in your knee. Yeah, I get it. But we are undeterred. We're not going to let anything trick us. So we've done a moonstone infusion. Lovely. All right. And now let me use the fardens and my garnets to draw stress off the system, because we talked about stress, so let's do that. I'll just use the fardens here on the big toes. Lovely. Now there's that flow, sort of feeling of everything emptying out, all the stress just draining off the system. Fabulous. Really, really good. Oh, lovely. And quick. I think that the sardonyx really prepped you well. That's it. That's right. And then to open up the channels between the chakras for an even better flow, we're going to put the garnet. I'll put them on top actually so everyone can see. Put them over there on the arch of the foot. That's right. Right. So what I'm going to do is I'm going to do anti-inflammatory for acute from the knee to the foot here, because it's actually all of this lower leg that's kind of tight and affected. Good. Nice. So let's get our green fluoride there. Very good. And then, here we go. Fuse. This is an energy field infusion. There, that's hitting the spot. There's this big elliptical motion. That's it. There it goes into the tissue. I just suddenly felt it penetrating. Very good. And actually that insight about the soles of the feet, let me just, yeah. Right, that's done. Now we use this one. And I say this green shows up well on this color here. That's good too. Good to know. Here we go. I'm just checking the texture and the quality as this goes into the energy field. And texture and quality of the etheric tissue, and it's pretty good. The thing with checking the quality of the etheric tissue, you have to become familiar with it. It's not something I can explain. It's something that's comparative from client to client, and from the same person to that same person a week later to a week after that. These are comparative assessments. So you have to have a bit of experience to be able to do that. And now I'm just pouring the green light from the fluorite obelisk into the knee, and there it goes. I'm actually going to lift that away and just get it into the knee joint. That whole capsule can do with a little extra anti-inflammatory work there. That's it. Good. There we go. And it's quite interesting because what appeared on my mind screen was rivulets of inflammation running down through this tissue here. It's like little rivers of inflammation. Not intense, but there. Distinctive. So I need to just pour the green fluorite into the rivulets to antidote them. And here, as I'm doing this, I'm visualizing the cells of the energy field, and that I'm pouring the green into the cells of the energy field. So up here, I was actually visualizing the knee itself. Over here, I'm visualizing the cells of the energy field. Because I need to get a wraparound effect, I'm working on the back of the calf muscle at the same time. So I'm pouring it into this tissue here, and from there it's going to transfer into the physical. Right, now the green apophyllite moves, so this now is treating. Now the spirit guides are reminding me that I didn't do the steps for irritable fascia, which are obviously necessary. And so I must do those next. And I'm asking the guides, what should I do? Should I stop what I'm doing and then do that? Or should I finish this? And they're saying, finish this step and the zincite step, then do the irritable fascia step, and then later complete with the green wand. So there, I've done that and that. So that's good. And now I must do the zincite step, the guide said. I'll use my zincite needle. I'm going to need this. And I'm going to do this whole strip. I'm going to come like so. This is 3D gridding. Right. Right. Good. Side. third dimension. Oh, there, that's the layer. Now that one I can feel really hitting the spot. Nice. Brilliant. And this is a crystal surgery, and so that's why Linda has fallen asleep. Despite being in front of the camera and all the talking. Right, so next I'm going to work on the irritable fascias. Actually, I need this here. And for this I use my Thunder Bear Amethyst, and I've got a nice red cap with a very nice little red head there, and my diopside. And it is very helpful to do the moonstone technique before doing this irritable fascia step. And of course we did do it. That's it. Now, I must pay special attention to her arms, so let's go up there. Look at this side. Right, very nice. And let us just use the green wand to finish off here now. Let's start with the fluorite end. You can see this is a somewhat different movement when using the green wand from when I was using the zincite wand, because it's a different action. Never skip any steps when doing anti-inflammatory for acute. Every step is important. Wow, that's great. And there we are, that's anti-inflammatory for acute. Next, we're going to work on the hands. Okay, so now what we're going to do is put some rose quartz stones. We're going to move into the next piece of the session. And I'm going to put my rose quartz stones on because we are still going to do the anti-depression procedure. And this is how we're going to get that moving along. We've done sardonyx, we've done shungite. We're going to do more, but let's get the rose quartz chakra stones on, and then let's go work on the hands while those rose quartz stones are doing their magic. I'll work over here. Let's pull that back. And let's take a look at this tissue. No sign of stress in your fascia right this second. There, more. Yeah. So it's important to note that the fingers work from way up here at the elbow, and so for massage therapists, all this tissue can get very overcontracted, and quite a few massage therapists have had to get help from me to do with their fascia here. And we want to get that to open and release. It's very responsive. I think everything we've done so far has been super, super helpful. And I'll just look for a few more hints of stress. There's one. Sorry about that, Linda. It does hurt. That's it. That's it. See, there's your hand lengthening out now. That's good. Oh, yeah. How's it feeling in here right at this moment?
It feels good with your healing hands.
Yeah, it says that my hands are comforting.
Yes, very comforting.
Right. Okay, good. Yeah, that's a little bubbly, isn't it?
Mm-hmm. Is that a tendon or?
Well, those are all the tendons coming down here, but it's a bubbliness in the fascia and in the muscles.
Mm-hmm.
You don't want that. That's it. That's it. So what I'm doing is I'm taking hold of that. I'm squeezing it and seeing whether that will release the tissue down here with what's in my other hand, and it is working. See how your hand lengthens out when I do that. So this is an Alexander technique move. We call it hands on the back of the chair. We get the thumb to oppose the fingers, and if I pick it up like that, that's Alexander technique. So it's like that, but otherwise what will also help is trigger point therapy, you see. And then the other thing that helps is aromatherapy oils. So lavender is very good. This is deep healer potion. That's a mixture of aromatherapy oils. And I'll just put this on. So we make this ourselves, the deep healer potion. And it's got a lot of aromatherapy oils in it and some other ingredients. Crystal elixir. There's crystal elixir in it. Now we can make a crystal elixir with the Thunder Bay amethyst and dioxide for the irritable fascia. It would probably work very well. So again, remember, I am not a massage therapist. I am just putting this deep healer potion in, and then I'm using my Alexander and healing hands for the hands-on contact and doing laying on of hands. So don't go beyond your qualifications. Don't go beyond what you're allowed to do by law. Don't go beyond what you know how to do. Oh, that's nice, isn't it? So I just want to be with this tissue. There we go. The less I do, the more she can respond. So allowing of flow. That's delicious, isn't it? Right. Very nice. Of course, people with arthritis really appreciate when you work with their hands in this way. Very nice. How's that feel?
Really good.
You are getting spoiled today.
I am.
Let's take a quick squiz on this side. This arm's a little tighter than the other because it's your right side. It's your dominant hand. That's it.
A little more into my elbow on that side.
Yeah, that's why I pick up this tissue here with my hands on the back of the chair. And Alexander hands and just get that. Wow, that's meaningful, isn't it? Woohoo, lovely. Alexander technique to the rescue. Oh, wow, there's the bone. Oh, there's what we want. Shoo. Lovely. Very good. That's it. That's it. We were watching a baking show and we saw the one guy's hands spasm up from kneading the dough for such a long time. Actually, I don't think it was dough, I think it was fondant. There we go. You see now the upper arm is releasing the lower arm. It was hooked together too harshly. There we go. Oh, good. Nice. All right. And just to be quiet with it is really important. So I just get as much of my hand on as close to the bones as possible. We've got the radius and the ulna in here. Just get to the bones. That's it. And then the tissue releases off the bone, and that's what we want. There's the hand. Relaxed now, fully relaxed. It's lovely. All right, so then we can put on some of our deep healer. Lovely, lovely. This is all. What you want is getting everything going in the right direction, and then, the body knows how to heal itself. It just needs a little boost every now and then, and so that it can do what it knows to do. Nice. Lovely. 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 Delicious. Very good. Alright, so that will get rid of some things that lead to irritability and stress and frustration. Your hands are not feeling good. That's right. There we are. We're going to move into the last phase of the healing session now, and for that part we're going to do the anti-depression procedure. As you know, we've done some prepping for that procedure already in bits and pieces as we've gone through the session, and now we're going to get into the final stages of it. I want to put these golden healer crystals to support the action here and here. And these we can take off now because we've finished with these. And once again, I must inform the entire energy system, what am I doing? And to inform, we're going to do the anti-depression procedure. I'm going to use my smoky citrine phantom with this fabulous material. That's a tabular crystal. You can see how flat it is. And you see that streak of smoky quartz going through it. It's really, really a nice one. All right, here we go. First we just grid and inform the whole system. Wow, that golden healer material there is hitting high spots. So I get this into the system, letting it know. This is what I want you to be paying attention to now, is working on antidoting the depression vibration. Like that. done the gridding with the citrine. I'm going to do a little bit more Alexander input in this time. I'm going to do the shoulders and get a bit more neck release. So let me go ahead with that. Here we go. I'm going to have my back to you, and then you'll see me do it on the other side. So I'm coming to this shoulder over here. Sit down. Get my hands under the shoulder. There we are. Just waiting for her shoulder to release. It's resting in my hand. There we are. Lovely. And then I go around to the other side of the table. And I do this side. And while I'm sitting here with my hands on the shoulders, I can tune in and see how things are going with the energy throughout the systems. You can check on the physical, the mental, and the energetic, all three of them. I'm doing different techniques and addressing all three layers, and that's my thing. That's what I do. Body, mind, and spirit, physical, mental, energetic. Lovely. Lovely. This hand is on her hand. My left hand is under her shoulder. And she's having a nap. That's it. It's lovely. Very good. Okay. And then come here. Check what's up. And she's beautifully relaxed. Everything is harmonious and aligned and perfectly delicious. So now I'll move forward with this. Get the bowl. So I'm going to clear the brain of the depression toxicity, we'll call it. And for that I'm just going to use my Shanghai pyramid and grid the skull. And it's very compelling to fall asleep during crystal surgery because it's like you go under anesthetic. So even though we have the camera on us and one could feel a bit self-conscious under the circumstances, even so, Linda cannot resist the impulse. She's fallen asleep, and that's just the way it is. Good. This way across. So there's nothing much for clearing except here in the prefrontal cortex. That's it. Right here. But as she said, emotions are running high at home. Well, whose aren't? Let's face it, we're all struggling with these same things. That's nice. Very good. All right. So now I take my lepidolite tool. So that's a little lepidolite and mica wand. And I'm going to do the same. Just grid the skull. And again, I'm not feeling any impediment except for this area here. one of the reasons is we recently did this for another procedure in another demonstration. So it's not that much. Then I take this lepidolite mica lingam, or you can use a sphere, and I'm actually going to infuse. And of course, what's making it this pinkish color, the lepidolite mica, that's lithium, which is the chemical that helps with depression. So lithium included quartz is a powerful tool to have in your box of crystals. Nice. Lovely. 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 All right, that's excellent. So now I'm going to do V-gridding to finish the antidepressant procedure, and then we will get into the final moments of what we're doing. So let's just continue with that. And it sure feels like we've been on quite the adventure today. So it's been rather excellent. So here we go. I have my Vogel style. This is not a true Vogel crystal. This is just an imitation. But it works, and it works well. And it is a particularly lovely rose quartz. And this is my citrine. And I V-grid through the system like so. She's very smooth now. It was a very well-constructed set of techniques and procedures. All worked well together. Time down the middle, or maybe more than one more time, but let's pay attention to the midline. Yes, very smooth. Perfect, and one more for luck. Delish. So now, energy generating. Get my two golden healers. I get as far away as I can, so I'm limited by the wall, no problem. And here we go, and I generate the energy, and I look up and see what's happening up at the head. And it's all excellent. Truly lovely. It feels very smooth, you see. It feels really, really good and smooth. Love this feeling. Nice. Now, here comes the worst part. I have to wake her up and get the stones off. I'm going to start here with the suture light on the third eye. And I'm going to take these rose quartz off. Then I'm going to take this stone off. And then take away the cachalon.
Oh
no.
hit that wonderful spot of La La Land or something.
Okay. And then we've got to do the cachalon from here. That's it, I got you. Alright. Just spray those two, and then we'll actually raise the vibration here. Lovely. Okay, you ready? Can I take the blanket off? Or are you staying the rest of the afternoon? Okay.
Okay.
Alright, here we go. Well, we still want to go back to the chair, you see, and so let's get you off the table. So wait for me. Let's just do this all properly by the book. And let me get that out the way. That's right. You bend your knees, lift them up off the bolster. That's it. There's two more stones. And then I need you to roll onto your side and push yourself up into sitting. Correct. And then just sit, because you're bound to have blood pressure change, which could mean that you're dizzy. That's it. Okay, so next we'll go back to the chair. Right, here we are, back at the chair. So after the table work, it's really important that I don't just send you on your way. I mean, you could have a car accident. That was quite the altered state of consciousness and so on. So I got to make sure that you're grounded. And I also want to check, in comparison to how you were before the session, how are you now after the session. I can tell one thing, you had a nap. Not unusual either, not unusual. Most people fall asleep for a few minutes on the table. It's very refreshing.
So relaxed.
Right. Okay, so your neck is much better. I can feel your feet clearly. You are taller than when we began. I don't know how you do that. I always think that you're shorter than I am, and the only reason I'm taller than you at the moment is because I've got my shoes on and you haven't got yours on. So that's quite interesting, and you're really present. I can feel all of that. So the only thing that I would say is that your head is stopping here. Your consciousness, your awareness of the top of your head is stopping at your eyes. So remember to feel the ceiling with the top of your head. Okay. Just that. And then your feet are really present and alive for you now, whereas I couldn't feel below the thighs when we were. Yeah, but I can really feel your feet. So let's check your balance on your feet. Drop your nose just a touch as you sit. That's nice, thank you. You don't want your neck to tighten back up again. That's it. Let me move your head. Thank you. Nice. Feet nice and lively. Lower legs. Very different in the lower legs. And there we are. Nice. And set your back, release. Don't try and be too upright. That's nice. It's soft and free of effort. Otherwise, it's not right. Okay?
Okay.
All right. Feeling grounded?
Thank you.
That was fabulous. Thank you so much, Linda. Thank you. Thank you.